Good evening, Los Angeles. Thank you for joining us this evening. Honor, courage, commitment. These were the three values I learned when I joined the United States Navy more than 13 years ago. I was proud to join one of the finest fighting forces in the world and to become a sailor with the camaraderie of the men and women who comprise an awesome ability to defend and protect us, but also to help us. Today in the port of Los Angeles, or as I like to call it, America's port, where 43% of the goods that come into America come through those majestic straits, we welcomed a new ship, the United States naval ship Mercy. Right next to that ship is the USS Iowa, a battleship that is a symbol of our nation's history, its power, and its might. It carried Franklin Delano Roosevelt overseas during World War II to meet with our allies to help win that war. And while battleships and aircraft carriers are the symbols of the power a nation can project, as I said today when I joined the governor to welcome the USNS Mercy to our port, a nation is also defined by how we can pull together and help one another. And today, that symbol, that ship, is in port. Let me put this in perspective. The 1,000 beds that are part of the USNS Mercy give us the ability to increase immediately by a third, and if we need to surge by 2/3, the number of available hospital beds for Los Angeles County. It's an incredible statistic. And the men and women who are on that ship, the Navy, Marines, civilians, the Coast Guard that is helping us protect that, and our port police, are fulfilling an extraordinary mission, ensuring that those patients who don't have COVID-19 will have a safe place to be, where they can find excellent medical care, where if they need it, there are ICU beds, and where we can ensure that we move them away from hospitals that will be surging COVID-19 patients into them. Every bed freed up in a hospital is one more bed for when the surge of patients from COVID-19 comes. With the arrival of this ship, we are now better prepared to handle that surge of patients we know will walk through the doors of our hospitals in the days ahead. And I want to thank the President and Vice President. I want to thank our governor and our senators, all of the people who knew somebody and made a call to say Los Angeles, with 10 million people in this county and 19 million in Southern California, needs mercy. And today, we got it. Thank you. Let me be clear, the importance of the Mercy isn't symbolic, it's real, it's tangible. It shows what we can do when we muster the courage and the resources to meet the grave situation of this crisis. And these hospitals beds will save lives, just as our behavior will. You see, these hospital beds are added to an inventory of just 23,000 hospital beds across LA County. That's our total inventory. And of those 23,000 beds, only 1,500 are available today for a hospital stay following a car accident, a medical procedure, and yes, COVID-19. We're seeing our trauma patients down. That's a reflection of your good work by staying at home, fewer car accidents. We're seeing beds that are opening up, but we're going to need so many more. And today, we have approximately 900 spare ventilators across the county that are available. So we have just 1,500 beds available to serve 10 million people. Together with the Mercy, now we have 2,500 beds. And while hospitals do have a surge capacity, we are collectively still going to hit a point where we will not have enough beds for all the patients we project to have. But thank you to you. Since I put out a call for medical workers, we know that it's not just beds, but the personnel who can serve those who are sick. And over 2,700 medical workers have stepped up and said, count me in. We're sifting through all of those resumes and all that help you went to, and if you still would like to sign up, you can do so at coronavirus.lacity.org/medical worker. And your expertise and your experience will help us to save more Angelinos. Now, not everybody in Los Angeles is going to get sick, but many could and many will. Today, we heard the new news 257 new cases, bringing our total up to 1,465 in LA County. This was a 20% increase over yesterday. And most tragically, there were 5 new deaths. And I'll pause here, as I will every night, to say to those who have lost a loved one that we mourn with you, that our hearts are broken. We know that nothing can bring back your loved one, and we see you and the cost of this crisis already. We mourn for every person that's lost here in LA, and the numbers are accelerating. We're glad today the numbers didn't go up as much as they did the previous day, but whether it's 1 or 2 or 3 weeks before we look like some of the other cities across this country and around the world, Dr. Ferrer said she expects to see cases double every 4 days for the next 2 or 3 weeks. And she and her staff are doing everything they can to find those cases, to communicate with people. And if you get a call that you have come into contact with somebody who is a positive, that is your warning. You must quarantine. You must stay away from other people, including your family members wherever possible. And you must ensure that you have 7 days with, when you get through it, and 3 days with no symptoms. A total of 14 days of quarantine is what's recommended, and it is just as important when you get one of those phone calls as somebody who hears they are positive, taking the actions to stop the spread. Los Angeles County cases now comprise 31% of all the cases in California, though we're only about a quarter of the state's population. And additionally, we learned today that the Department of Public Health is undergoing a case investigation of one unhoused homeless Angelino who is now isolated. And they're doing contact tracing and finding out where this individual has been, who they've been in contact with, and working to reach out to communities that they have been in contact with. And I want to pause here for a moment, because for those who might say, we can't have a shelter where we are, we can't help the homeless right now, remember, it is those of us that are housed that had more than 1,000 cases before we have one now that we believe is an unhoused Angelino. This is something we're bringing to the street, but it is our responsibility. The most vulnerable and susceptible people that we have, vulnerable because they are often living on the streets with pre-existing health conditions, and susceptible because they don't have a place to go to self-quarantine. It is our responsibility to step up big. And so we're addressing this homeless crisis head on. And I want to thank the collaboration in the county, from the state and federal government, who have finally unleashed some of the dollars that a year and a half ago, when I said we need a FEMA-like response, we're actually getting a FEMA-level funding. We today opened 5 more rec centers with beds now, a capacity of 566 beds, and we'll see a 50% increase next week. So there are now 13 recreation centers open, acting as shelter, with folks who are screened before they go in to make sure that they are healthy, but that they are now safe off the streets. And the county has nearly increased by 50%, working with us and other cities with the state money to secure hotel and motel rooms for isolation and quarantine for our homeless neighbors. And LAHSA is looking at nearly 50 potential motel and hotel sites with 5,500 rooms countywide. This will secure temporary housing for our most vulnerable populations. And while we're preparing for all of this, we should do everything within our power to flatten the curve, to get ahead of this curve, to knock it down. And testing, as I've always said, is absolutely critical. While we were awaiting the cavalry to come from Washington or elsewhere, we didn't wait. We started ramping up testing. And I'm proud that the 4 sites that we launched on Monday have now completed over 5,000 tests, and we're getting the results of those tests back on average in 1 or 2 days, rather than the 5 to 7 days that many labs were sending test results back before. This information is knowledge, and that knowledge is power. Knowing how many people are sick, knowing who they came in contact with, helping the county make sure that everybody is contacted, and stopping the spread of this virus. And when it comes to testing, we expect next week to more than triple that number, from 5,000 to 15,000 tests that we will do at those 4, and now a 5th center we will open on Monday. But on the testing front, we have some other good news as well. If you, like me, are always excited, when I was a boy, I loved when a UPS truck would pull up. And UPS always delivers a package, something you need at home. And UPS tonight is going to deliver when it comes to COVID-19. We're the first city in America that will have a partnership with them, where they will pay for, deliver, and pick up tests, thousands a day inside Los Angeles. This weekend, we're going to work hard to set up those sites, to have them ready next week, but that could even add thousands more a day so that we can get more information and stop the spread. And I want to thank you, UPS, for stepping up and delivering for us yet again. And I encourage Angelenos who want to get a test, who have severe symptoms, or who are vulnerable, to sign up for one of those tests. We've been keeping up with the demand that's come so far, but again, that's at coronavirus.lacity.org to see whether you're eligible to get tested. Not everybody can get tested. The advice, of course, from public health is mild symptoms. Treat it like you do have it. But for those who are worried that this would be more than something mild, please go through there, fill that out, and make sure you do everything to protect yourself. And we're looking at every resource at our disposal to deploy emergency hospital beds as well, so we're better prepared for the inevitable surge of patients. And most of all, we're physically distancing at home and for those who are in critical industries at work. You know, we've seen this. Everybody thinks it's not going to actually come to me, to my neighborhood, to my city, to my state, to my country. But COVID-19 is coming everywhere. I shared with you the statistics in the heartland last night in states that would be very rural, like Wyoming or North Dakota, who are a day behind us in per capita cases. We saw how Iran was the new China, Italy was the new Iran, Spain was the new Italy, New York the new Spain. So rather than asking where Los Angeles is headed, let's just stop the spread. Let's do everything we can to become the most of a success story that we can be. And we're learning so much about this virus every day, how to fight it, how to stop it, from our partners in California, in other countries, and around the world. This is a truly global crisis, and no city is immune from it. Today, in my role as chair of the C40 Cities Global Environmental Organization, I convene mayors from virtually across the world to pool our knowledge, to share our best practices, and to help chart a path forward. We heard from the mayor of Seoul about what they did in South Korea with testing. We heard in Milan about their physical distancing and public education. We heard from mayors from Johannesburg and Paris, from London to Guadalajara, from South America to Australia, Jakarta, and others who were sharing with us their best practices in places like Hong Kong. It makes us all stronger when we can come together and share those resources. We heard how cities are leading, how New Delhi declared, as we did here, a stay-at-home order, and then a nation of 1.3 billion people followed 2 days later. Cities have to lead because we're at the front lines of this fight, but together we are stronger. And we're rising to meet this global challenge with that spirit of collaboration between cities, something that knows no borders. The response to it should also know no borders too. As we head into the weekend, as we feel this kind of artificial, for many of us who were home this entire week, moment of inflection, I hope it's a time for us to pause. Whether it's lighting candles tonight, whether it's sitting down around a dinner, whether it's a moment just to breathe and to check in with each other. Because we know after another week being cooped up indoors, we're going to be tempted to say, well, why do we have to keep doing this? It's going to be sunnier and warmer. Springtime weather is coming out. You might say, now it's time for me to go outside. Don't. My message has been very clear, and at 6 p.m. this evening, we are sending out an emergency alert message reminding everybody that the safer at home order remains in effect. Stay home. It's that simple. And I know it's tough, but seeing our neighbors and loved ones die will be so much tougher. If you want to know which activities are safe and essential and which ones should be avoided, all that information is there at coronavirus.lacity.org. You can click right from your phone and read it. And we can't forget, even if you're from part of an industry or a government worker that's exempt from our order, you still need to practice safe physical distancing. I've witnessed, and so many people who've called us have witnessed, too many people that are not, whether it's on a construction site or whether it's folks that are fixing a street. And trust me, I'm putting that message out to all of our city employees to protect themselves. And make no mistake, we will have to shut down those folks who don't practice safe distancing. So especially to my friends that are in the construction industry with critical infrastructure and work, you're putting yourself at risk, and we're only going to be able to continue that essential work if you are maintaining the safe distance ordered in the Safer at Home order. Last weekend, we know we saw too many people that were unfortunately crowding close together on beaches and on hiking trails. And this one is particularly tough because it kind of defines who we are as Angelenos, being able to go for a jog on the beach, hike up in a canyon in the Santa Monica Mountains. But it was reckless and it was dangerous because spending time in crowded places allows COVID-19 to prosper, to spread, and that means the deaths of our loved ones, our neighbors, our friends, and family. So we aren't taking any chances. And last night I announced the closing of all park amenities, including skate parks and tennis courts. And this weekend we will take another important step. As of today, all public trails and trailheads in our city are closed. At Griffith Park, the Vermont Avenue and Ferndale Drive entrances are closed. And all beaches, piers, and beach parking lots are closed too. I consulted a lot with my fellow mayors of beach cities. I talked to Dr. Ferrer, who said there's no city in the world in the beach that has partially closed a beach. They're all closed in Italy, in Florida, in Brazil, in places that are equally defined by the beauty of their coastlines. This is necessary, and I know it's painful, but we must do it. We are following the data, and we're studying what has happened in other cities, and we only listen to the science and to those experts. This isn't a hunch, it's a fact. When you gather, you spread the virus, so do not gather. And for those who say we need to keep the economy going, the best way we can look after the economy is to stop the spread of this disease. It's a false choice to think that somehow if we keep the economy open, it won't have an economic effect. It will be even more devastating if we have triple or quadruple or 10 times the number of patients dying. These are employees, these are employers. It would be devastating in an even deeper way than I know the intense pain that people feel economically now. And so we will push on and we will march on together. And as long as we hear reports of gatherings or we see images of crowded places, we will keep making necessary changes. But even as we act to protect Angelenos, the most important decisions, the most consequential ones, are ones that you make. When you decide that you know better, when you choose to defy these orders or show disregard for every doctor putting their life treating patients in the emergency room or a nurse doing intake, every grocery store worker, and we lost one in Pomona, we know that these essential workers are there for us, so we have to be there for them and for each other. Every government employee who's risking their life to keep your lights on or when the power goes out, please stay at home. These aren't suggestions. I remind you, these are orders. We are in the midst of a pandemic, and all of us are making sacrifices, and all of us must do our part. And in terms of what's coming out of Washington, D.C., well, I'm glad that this third bill has now been signed into law and will provide a large measure of relief in the short term. I agree with what Speaker Pelosi said. Right now is the time to get to work on the fourth bill that will be about economic recovery. That while we look at assistance and aid, we saw in the first stimulus that was focused on preparedness and emergency response, FEMA, the second, which was putting families first with free testing, paid sick leave, and unemployment insurance, and this third one, the $2 trillion that are investments for working Americans, struggling households, for our homeless neighbors, and small businesses affected. We have to begin that fourth step now to plan for the light that is at the end of the tunnel, for the economic recovery recovery we must drive now. And that's what drove, I know, much of the City Council's actions that are still underway, I believe, as I speak. Our council members voted to require retail food stores to dedicate 1 hour in the morning exclusively to our seniors and to the disabled. This is something so many stores that people with disabilities, can go for. This is something so many stores have done across the city, an act that keeps individuals most at risk of COVID-19 safer. And I'm grateful to the council for passing this common sense measure. Council also took a step to secure basic rights for grocery and food delivery workers, the right to change your schedule, to stay home sick, or to provide childcare, the right to being offered more hours if you're a current employee before a store hires new employees, and the right for food delivery people to do a no-contact delivery and get training on how to do that. Cashiers at our local markets, the workers restocking the shelves, the drivers who are getting food to our grocery stores are the frontline workers in this crisis, and they deserve every ounce of our support and protection. Thank you again to all of you for stepping up during this crisis. And I also want to thank Governor Newsom, who stepped up today and built on what 30 cities had done across California, including Los Angeles, by ordering a statewide ban on evictions for renters affected by coronavirus. Some of you may live in the city of LA and you are already covered, but you may have family members or some who are listening in cities that had not yet enacted that. With rent coming due on April 1st for so many tenants, this is welcome news for struggling Californians everywhere. Your city and your county and your state and federal governments are responding to this crisis at every level. But so are the people of LA, even more so. Residents, families, entrepreneurs, philanthropists who are stepping up to fill the void and to give help. I talked with somebody today who said, oh, in my foundation, this might mean dipping into our principal, into our endowment. And I said, if ever there was a time to tap the savings that a company has or the endowment that a foundation is lucky enough to enjoy, it is now. We're doing that as a city government. We're making sure that our reserve fund is for moments like this, and that we are spending it on making sure that our city responds to this crisis with every ounce of muscle we have. Investments like $1 million for the city's Department of Aging that have come from a philanthropist to address the current gap in senior meal delivery as more seniors are isolated than ever before. Other acts of generosity and donations that have come in, a grant of $170,000 to provide 2 weeks of shelter for 100 domestic violence victims in hotels, as too many of these victims have been turned away from shelters. And when we say stay at home, the last place we want people to go to is a home where they're in an abusive relationship. Make no mistake, we expect a spike in demand for vital services as this crisis persists, but there are so many people who have begun to help us. I want to thank my friend Mark Stern, who's the chairman of the TCW group, for not only making a generous personal donation, but to him and the group's CEO, David Lippman, for establishing a matching programs for employees to make a meaningful corporate donation. And I encourage those employers who can set that up as well. Because in Los Angeles, we don't turn our backs on our neighbors, we turn our faces to them. And altogether, as of tonight, we've raised more than $2 million to support the people in Los Angeles hit the hardest by this public health and economic crisis. And tonight I call on every person that if you can, and we know that many of you can't, you're going to be the ones we're focused on giving this to, but to come forward and give to the Angelino Fund. All you have to do is text LA Love to 21,000 or visit mayorsfundla.org/Angelino. My fellow Angelinos, these are crucial days, and they are painful days. I know many of us at night close our eyes and wish that this would go away. We wake up in the morning with a prayer to help us get through this day. And the pain that we will have to hold and contain, especially for those families who have lost someone and those who have somebody hanging on, will be our collective work. Every decision you make counts. Every action you take will save a life. When this is all over, the beaches will still be here to enjoy. I know I'll be heading to Griffith Park that day, taking a hike to the highest peak in that park and looking around at the beautiful view of the most incredible city in the world, our city of angels. Know that these things are temporary, and while they might feel long, they will be but a small part of our lives, but a critically important one. And yes, we will ask ourselves, and our children will ask us, and our grandchildren will ask them what we did at this moment. And let us make sure we say we did everything, so that our numbers, which could have been higher, weren't. So that the lives we never can name are still here. That those amongst us who would have been afflicted weren't. And that we rose to the moment of this challenge, to not just survive, but to thrive once again. So keep your physical distance and make smart choices, and know that your government will continue to be here, functioning every day and doing everything we can to help you survive. So stay healthy, stay safe, and stay home. Strength and love, Los Angeles. Thank you. Happy to take questions, so I'm going to keep my answers tight because time is short. If we can go to the first question. Go ahead. Do we have a connection?
Our first question from the phone comes from Robert Kovacek from NBC. Please go ahead.
Hi, Robert. Go ahead, Robert.
Newsroom. You mentioned the $2 trillion relief package that was just signed. I want to talk a little bit more about it.
Yes.
Governor Cuomo reiterated minutes ago on MSNBC what he said all along, that this relief package is a drop in the bucket. He added just now that it has failed state and local governments. So how do you, Mayor Garcetti, define it for LA? And if you can elaborate on what will be needed next.
Look, $2 trillion is not a drop in the bucket, but when we look at the collective need, I understand what the governor is saying. If we think this is going to get us through the rest of the crisis, Washington needs to sharpen their pencils and tomorrow be back on the next phase. We need to make sure that families can survive, not just maybe with a single payment, but depending on how long this is, Washington needs to provide for the businesses and the workers, needs to provide for those who are left behind in this, because some, like our immigrants, weren't included, even though they work hard and make this country strong. But there are some really important pieces in there, which are not chump change. For us to be able to get over $30 million for our homeless efforts, that's significant. For us to look at hundreds of millions of dollars for our airport and for Metro, to keep those vital things going, whether it's our infrastructure work at the airport or making sure that buses and trains can continue to take critical workers to work, that's significant. When we look at the direct aid for cities and the community development block grant dollars, that can be shared immediately with the least and the lost and the last amongst us. So I do think we need to do more. But I also think that this was a good start. It's easy right after something like this, which was greatly improved by folks who insisted that there actually be more for everyday Americans, that we not look at that and say, you failed us, because I think they did their job this week. All we're saying is next week, get ready to do it again. Next question, please.
That comes from the line of Steve Gregory from KFI Radio. Please go ahead.
Good evening, Eric. Today when you were with the governor, kind of coattail on Mr. Kovacek's question, talking about money and funding and readiness and whatnot, the governor did mention that at the current rate, that the city of Los Angeles could very well be looking at New York City's sort of surge within the next couple of weeks, and I believe you reiterated the same thing. Is Los Angeles ready, as it stands right now? Currently with the ship in harbor and our beds in all of our hospitals and all the equipment and all the safety gear, is the city of Los Angeles ready for a New York City-style surge?
No city on the face of this earth is ready for that. We have been really crystal clear. While each day we add more in bed capacity, in personnel, in equipment, in the physical distancing, there will be a point, I've been very clear, where our capacity to meet the challenge will be overrun. We have to ready ourselves for that and do everything we can to push that date off. there might be a glimmer of hope we don't get there, but the evidence seems to show otherwise. And when we're a week or two away from where New York was just a day or two ago, that means that it's coming. We need to be prepared. And I hope that makes people redouble their efforts, the federal level to get us the help that we need, to coordinate this so we don't have this, zero-sum game out there where one city is stealing the masks from another and the federal government and FEMA is taking them just as we're about to have a contract. That needs to be coordinated. That needs to be distributed equally. And that needs to be something shared equally among all cities. So I wish I could say that there were better news, but we have to be prepared for what lies ahead. And there isn't just Los Angeles. This is going to be across this nation, what all cities and states will face. We're woefully unprepared collectively in this country and in almost every country in the world to meet this challenge. And so that is why it is so critical for us to step up and lead. That's why it's so critical for us this week and next week. We will know about 10 or 12 days into our physical distancing measures, I'm told by experts, what sort of effect it's having. And if we can see the percentage increase come down, we just may be able to manage most of the cases that come, save most of the lives that otherwise could be lost. That's worth fighting for. Next question.
Thank you. And that comes from Alex Michelson from Fox 11 News.
Hey, Alex.
Go ahead.
Hi, Mayor. Let's talk for a moment about the issue of homelessness. Can you give us any more information about that potential homeless patient? Is this somebody that was living on Skid Row? And on the homelessness issue writ large, if we are putting homeless people into shelters, into hotels, into trailers, what about the accompanying services for homeless that may be suffering from drug addiction issues or mental health issues?
Right. Great question, Alex. So first of all, no, I don't believe they came from Skid Row. They were, as the county has done on Dockweiler Beach, where there are trailers for isolation, that's where the person was. So they were already off of the streets, and now they've been taken there to a place where they can isolate and have medical treatment. So with a single case, what we've set up is working. But when we look at the other issues that folks who are unhoused often face, we absolutely need to look at this not just as a moment where we shelter them in a shelter or at a motel, but where we get them permanently out of homelessness. And we will absolutely not bat 1,000 when it comes to this. But if we could even double the pace of what we were doing, we would begin to see more people coming out of homelessness than going into homelessness when this crisis is done. I know that our Homeless Services Authority, my deputy mayor, Christina Miller, and the county have worked on basically a flow chart. So somebody out there who doesn't have symptoms, where we put them is going to be different than somebody who has symptoms, who then will have to get further assessment. If they have COVID-19, they will have to go someplace else. If they have with them a set of already health issues or psychological or addiction issues, we'll have to put them with more care around them. And I've written our County Board of Supervisors, our chairwoman, Catherine Barger, who's done an extraordinary job, about some of the things that I think can help us coordinate that, some of the things the city and cities across the county don't specialize in. But I want to give the county a lot of credit. In each one of the shelters, they've put somebody from the Department of Mental Health. We have 2 police officers in each one of those 24/7, and they're trained on de-escalation and mental health. So we have folks around that can, at least with the beds we've opened so far, deal with those health and psychological issues. But as we scale this up, we're going to continue to need to bring that in, and we're going to continue to need those experts to come and support us. Thank you. Next question.
And that comes from the line of Claudia Pesciuta from KNAX Radio. Please
Hey, Claudia.
go ahead.
Hi, Eric. I wanted to ask you 2 quick questions.
Sure.
We're hearing that some of the restaurants that have been shut down for dine-in eating have, been operating as grocery stores, and now they're being shut down by public health because they're not licensed to operate as grocery stores. I'm wondering if that's on your radar and whether you plan to do anything about that. The second question is, while you're still urging people to sign up for testing on the city's portal, there are no appointments available.
So we have been meeting, so let me start with the testing. There are some days in which we didn't have all the appointments filled by a couple hundred. We always take those tests the next day. That might be real time today. If folks aren't ready for one day, we now have it so that it'll kick them off to the 2 days or 3 days ahead. But so far, we've almost person for person been meeting. We can get you the statistics. It's not like 5,000 people go on and only 1,000 who qualify, by the way, get the test. It goes through, not everybody qualifies right now because there aren't infinite tests, but so far we've been able to meet those who do qualify, their demand either that day or it might be in a case or two the next day. But so far so good. And with the expansion of that next week, we'll be, again, opening that aperture more. And as I said, we'll be doubling the pace, which will allow us to triple the number of tests by the end of next week. With the UPS ones, maybe even more than that. Second, we're aware of the issue. That's obviously county public health, and so we've brought it to their attention. We've asked them. I think this is absolutely a time for people to be creative, to relax whatever rules, as long as people are operating with safe distancing and critical businesses to help people get food and to help people survive. That's my philosophy, but that's a call for the county public health. Next question, please.
We have no more questions in queue. Please continue.
Okay. All right. So I'm going to say a few words in Spanish. Thank you again to everybody. I won't be making an address tomorrow. I'll take Saturday off as I did last week, but I will be back on Sunday with critical information, with updates, with messages. Do your part this weekend. I know it'll be a little tougher than you thought for those of you who are going to go to a hike or maybe go to the beach. This is a critical week, and I hope in the next week or 10 days we'll be able to share the news of what our collective work has done to the curve together. Thank you. Are we going to switch up? Oh, that's right. Bilingual, and I thank again our interpreters. Muy buenas tardes, Los Ángeles, y gracias por venir. Hoy recibimos el mensaje de generosidad y de sacrificio de nuestra Armada Naval, con la llegada del buque hospital USNS Mercy a nuestro puerto. Con este barco ahora tenemos 1,000 camas de hospital que no teníamos ayer y estamos mejor preparados para recibir el flujo de pacientes que entrarán a nuestros hospitales en las próximas semanas. Gracias a la Armada Naval, a nuestro presidente, gobernador y senadores y toda la gente que fueron parte del equipo a traer este barco al puerto de Los Ángeles. En el condado de Los Ángeles tenemos 23,000 camas de hospital y casi 19 millones de personas en nuestra región. Y no están todas las camas vacías. De hecho, ahora nuestras camas están a 90% de capacidad. Solo tenemos 1,500 camas disponibles para uso hoy. Por eso, este barco es un gran recurso para nosotros y para la región. Hoy tuvimos 257 nuevos casos positivos. En total, 1,465, un aumento de 20% desde ayer. Y 5 más fallecidos. Y a todas las familias de los fallecidos, lo siento mucho por su dolor. Y estamos contigo en este momento trágico. El condado de Los Ángeles ahora tiene 30% de los casos en California. Nuestras cifras están subiendo y hoy la doctora Ferrer nos dijo que espera ver que los casos van a doblar cada 4 días durante las próximas 2 o 3 semanas. Por eso estamos ampliando las pruebas de detección. Desde que lanzamos el programa el lunes, hemos hecho 5,000 pruebas. Esta próxima semana vamos a triplicar este número. Visiten la página coronavirus.lacity.org para determinar si eres elegible para hacer una prueba gratis. Mientras nos preparamos por eso, debemos hacer todo lo posible para aplanar la curva. Esta tarde, a las 6, se mandará una alerta de emergencia, recordándoles que la orden más protegidos en casa sigue en efecto. Tienen que cumplir con esta orden para la seguridad y la salud de todos nosotros. Además, este fin de semana cerramos todos los caminos públicos en el condado de Los Ángeles y cerramos todas las playas y los estacionamientos y todos los puntos de acceso a los muelles y las playas. Y recuerden, si siguen trabajando en una industria esencial, especialmente en construcción, necesitan cumplir con las prácticas de la sana distancia. Sin su participación, necesitamos cerrar estos sitios de trabajo. Por favor, ayúdanos. Sabemos que cuando se reúnen, el virus se transmite, entonces no se reúnan. Estas no son sugerencias, son órdenes. Estamos en medio de una pandemia. Todos necesitamos hacer sacrificios. Todos tenemos una responsabilidad en esto. El COVID-19 es una crisis global y todos estamos en riesgo. El compartir información, tomar acción rápidamente y la colaboración nos ayudarán a sobresalir juntos. En las últimas semanas, nuestro Congreso ha tomado acción decisiva y estoy de acuerdo con el enfoque de la líder Pelosi. Primero se enfocaron en preparación y respuesta, después en protección de familias con pruebas de detección gratis y beneficios de desempleo, y tercero, el paquete de hoy, invirtiendo $2 billones en apoyo económico para familias trabajadoras. Y el cuarto paso, en mi opinión, en la opinión del líder Pelosi, debe enfocarse en la recuperación económica. Tenemos que empezar esa inversión ahora. Gracias a Washington por sus pasos de esta semana, pero necesitamos continuar este progreso en la próxima semana también. También quisiera agradecer a mis colegas alcaldes en el C40, un grupo de alcaldes luchando por nuestros medio ambientes en todas las ciudades del mundo, por unirse conmigo por teleconferencia para compartir experiencias e información. Los alcaldes en Seoul, Corea, en India, en Sudamérica, en México, en China, en Japón, en todos estos países están trabajando juntos a combatir esta crisis y este virus. Con este mismo espíritu de colaboración, hoy nuestro Consejo Municipal aprobó ordenanzas para proteger los derechos de nuestros trabajadores esenciales en supermercados, en servicios de entrega a domicilio. Gracias por el liderazgo del gobernador Newsom. Gracias a la gente por sus acciones. Continúa a asistir la gente de Los Ángeles al fondo de asistencia. Para donar solo tienen que enviar LA Love a 21,000. Gracias por su generosidad a nuestros vecinos. Amigos, quédense en buena salud, quédense protegidos y quédense en casa. Fortaleza y amor. Hasta domingo.